Some IPR tips. All right, what is this thing? Yes, it's a quick strip. It is used for IPR. There are many techniques for IPR. My favorite one is using quick strips to help open up the contact, and then I go in using a ghost disc or mosquito burr, depending on the case. Also, stop saying IPR to your patients. Nobody likes the idea of it. Nobody really wants to hear about it. What it is it's polishing. You are polishing between the teeth to open up space to solve the crowding. If your patient is curious as to why you need to polish between the teeth, it's because their jaw is not growing anymore since they are an adult. And so their teeth don't fit in their jaw. That's why there's crowding. So you have to create space. One way to create space is to pull a tooth. That is very aggressive. So instead, we polish between several teeth, just enough for floss to drop through to achieve optimal results. So I'll dive into a lot of that stuff here in a sec, but that's kind of like the overarching way to look at IPR when you're doing it and also talking about it with your patients. And so like I said, IPR is meant to create space by removing the friction between the teeth, so that way you can move the teeth into the correct position. And friction is the best way to think about this. So I know I said earlier it's like driving teeth past each other, and your job is to just remove that friction to make the movement easier. And so I know we said, who kind of like cringes at the thought of doing IPR again? Yeah. Huh?
I hate it because the patients hate it.
Yeah.
It's never I haven't done it myself.
What's the worst interaction you had with the patient when you were doing IPR? Did anybody have like a patient like cry or freak out?
Oh, I had an anxiety patient. She can't even get a filling without his annex. So the IPR was just the whole thing for her.
It just sent him over the top?
She was just like freaking out. And I was like, well, you have a lot of crowding, so it's going to take me a minute.
Did you freak out or no?
No.
Wow, you're better than me.
Stop crying.
Yeah, you're better than me. One of the first times I did IPR, I told the patient about it and everything. And then we sit down, and then like I'm about to start, and then she just starts like crying in the chair. And then I was just like, "Are you okay? Like, what's going on?" She's just like, "I don't like this." And I was just like, "Oh." And so I was shaking. I was like, "I don't like this either. Like, can we just like get through?" Like every 2 seconds, I'm like, "Are you okay? Are you okay?" So that was probably like the second time I ever did IPR. So it was super traumatic, and I was like, "How the heck do people do this?" But then the more that I did it, the more that I found like some patients weren't even, then the next patient I kept asking them, and they're just like, "Yeah, I'm fine. Can you just," they're like, "It'd be great if you could just like finish it." And I'm like, "Okay, yeah, it's cool. Like I'll move forward here."
Yeah, I need to get that hand cramp. You're doing it with the discs. I'm like, oh my, I'm a workout here. I'm like, give me a minute.
How are you usually doing it? Just disc the whole way?
Most of the time.
Okay, so I'm going to share some techniques that'll help definitely with that. Yeah, the hand cramp
I'm
is.
like, I'm going to get purple tunnel by the time I'm 40.
So the IPR talk track. So basically, there's 3 parts to it. There's the struggle points. There's phrases that we should avoid using, and then there are 6 power phrases that really help, right? Because the experience of doing IPR is going to come down to making sure that everybody, like you want to set the expectations with the patient, and then you want to make sure that you're delivering on those. So I'm not saying like lie to them or tell them one thing and do something else, but there's certain ways that we can phrase things to make it a more enjoyable experience. So why are dentists afraid of just even talking about IPR? Well, first of all, it's the lack of education on how to do IPR, right? We don't have a predictable or reliable way to do it. And some people don't feel comfortable in removing healthy tooth structure, right? So these are all valid things. And like I said before, it's ironic because nobody will bat an eye to shave a tooth down to do a crown, but we got to take 0.3 millimeters off in between 2 teeth, and everyone's sweating. So just know, right, it's really not that much tooth structure. Like I was saying, between 2 teeth, if the 0.5 millimeters is the most you're going to do, you're only removing 0.25 millimeters from each tooth. So that is really nothing, because teeth in general have 2 to 3 millimeters of actual healthy enamel. So you're barely going through these teeth. Yeah, and I shared with you guys the story of my patient who freaked out. So basically, A surefire way to just absolutely scare the crap out of your patients before on IPR is to use one of the following phrases, and maybe you have. But yeah, basically, before I tell you the phrases, why do we struggle to communicate with patients? And like I said before, no one trains us, no one teaches us how to talk about this stuff. We all learn from a science and clinical-based background. We weren't learning how to actually deliver the message. We were just learning the science behind it, right? We all think that everybody knows and cares about teeth just as much as we do, right? That's just kind of who we are as dentists, and it's not a bad thing. It's just kind of how we were taught to do things and what we do and how we interact with people. So it's very important to talk about this in the right way, because the patient is going to sense your feelings. They're going to sense your confidence, right? If you're scared about this, they're going to be scared. They may have no reason to be scared, but if they can sense that you're hesitant, they're going to freak out. So certain words that we use have negative connotations that we are just unaware of, because dentists will use them freely, and so we just think that's just how we're supposed to talk about stuff. But to the average person, they're going to look at you and be like, what are you talking about? I don't want any interest. I have no interest in what you're doing. So basically what we want to do is we want to paint this part of the procedure in a positive light, or as positive as we can. So definitely don't use any of these words. Don't say that you're shaving teeth. Don't say that you're going to be stripping anything. No grinding. No drilling, no chopping, no slenderizing, and definitely don't say IPRing. Again, some of these words like stripping and grinding, like it's just, people will feel very comfortable saying that, but out of the context of, I guess, doing IPR, like it's not something that people necessarily like talking about all the time. So these are real. Like these are words that people will use, and sometimes we forget that how this comes across.
So if you're enjoying this video or found it helpful in any way, I'd really appreciate it if you could just share it with one of your dentist friends. Just copy the link, drop it in your favorite group chat, or post it in one of your favorite Facebook groups or communities, and just share it. That's it. My mission at the end of the day is to make aligner education accessible to as many dentists as possible. And so by sharing this video, you're going to help me move closer to this goal, and I really appreciate your support.
Okay, so 6 phrases that you guys can use. All of these are going to paint it in a positive light, right? So you can tell them, hey, look, we're going to do some flossing with the smoothing device. Like that seems approachable, right? Because again, you're not lying and you're telling them, like, we're going to be, like, flossing can be the motion that you're doing, and it's with a smoothing device. You can let them know, like, hey, this is going to be quick and minimal, right? We're going to do this. It is quick and minimal. Another thing you can let them know is, like, yeah, it's going to be virtually unnoticeable, right? The only people that are going to know are me and you, because that is true. When you're doing IPR, other people are not going to really know. Only you and the patient will know, and sometimes the patient doesn't even know. My favorite is polishing. You just tell the patient, look, we're going to polish between your teeth. And when you say that, it has a very nice, it's a familiar word. It's not invasive, and it even sounds beneficial, right? And then you can let them know, it'll be painless. So that way, if that's something that they're hypersensitive to, it is relatively painless. And another kind of compound phrase you can use is you can let the patient know, like, hey, listen, your teeth, when they're coming together, that's too tight. And so I need to polish with this smoothing device to relieve that, so that we can move the teeth into a healthier position. That's it. It's like clean, easy, patient will take it. And then if they have questions, they'll ask. If not, stop talking and start doing that part of the procedure and move on, because there's no reason to further explain that. So yeah, so you can tell the patient this, right? Your jaw's not big enough to fit all of your teeth, so we need to polish between some of them to create space for them to move into. The space is minimal, just enough for floss to drop between the teeth without getting stuck. We will close those spaces with the treatment and get your teeth into a healthier position. And so if this is what you say, you can, use it verbatim. And 9 times out of 10, the patient's just going to say, okay, cool. The one patient that asks a question, address whatever that concern is. And just they're probably like, oh, is it going to hurt? And you'll be like, nope, it's painless. Okay, cool. And if you're giving enough information here for them to understand what it is. And by doing that, the number of questions that are going to come are going to be very minimal, okay? We talked about this earlier, but basically the moving around IPR, right? So 0.2 IPR, you may have heard from other people, is that, we refer to it as fake IPR. And so basically this is the concept of moving multiple places of 0.2 and consolidating it into 0.5 around canines, so that way you're only doing some IPR in a couple places.
Do you have crowded teeth and your dentist is recommending to straighten them out? Did they also tell you that they have to shave your teeth down to make space? Well, first of all, it's not shaving, it's just polishing. And I'm gonna show you exactly what that procedure looks like.
So that's 0.5 millimeters of space, which is the most you'll do. So yeah, there's a little bit of space there, we can all see it, but that's something that's gonna close up. And so that sequence that I just showed you guys is the GHOST system. And the GHOST system is basically a combination of using quick strips followed by the GHOST disc. So the GHOST system is going to be a combination of, okay. It's going to be a combination of using quick strips with this device here. So the quick strips are the strips that you can use that help open up space. So it comes in different widths, right? 0.2, 0.3, 0.4, 0.5. And you first use the single-sided ones just enough to where those discs are dropping through. You usually take it up to about like 0.3. And then once you do that, you would load this handpiece with the smallest width disc, which is 0.15. And this is an electric motor that this comes with. And then all you're doing is you are going between the teeth like you saw, and you are just dropping down until you basically break that contact point, and you come right back out. And you just go in the sequential order up until however much you have to do, 0.4 or 0.5. What's nice about this disc is it's got an internal cutting surface. It's not end cutting. So it protects the patient's, it just protects the amount of tooth structure that's actually being impacted, and it prevents ledging and stuff like that, which I'm going to show you guys pictures of. And then it also comes with like a protective metal casing, so that way the actual cutting surface is like this much as opposed to the whole disc being exposed. And this is a traditional disc system, right? I mean, this is like a borderline torture device with this thing. It's like you're ripping this thing on the handpiece, and it's a saw, like a mini buzz saw pretty much. So some people are really good at using it. My recommendation is don't do this when you're starting. There's just a huge margin of error because stuff, basically, I mean, in theory, it sounds great. Like, yeah, load this disc, just buzz on through and you have your space. But reality doesn't work like that because friction is a thing, right? So, this is a nice video just showing you like, yeah, like, this looks so doable. Like, just take this disc and just, yeah, it's like the teeth are barely touching. It's like, cool, let's just kind of widen this out. So yeah, again, in theory sounds great, but it's not going to always be like that. What usually happens is stuff like this. Lips are getting cut. This is dangerous, honestly. It can also, the worst thing that can happen is, I don't know what's going on with this clicker. Ledging, okay? So I know we talked about IPR in the posterior or the anterior. Anytime you're using a disc system, you're at a higher risk for ledging. And so what ledging is this is not like a class 2 prep. This is a disc that they went through, and because of the angle, they chopped that tooth right there. So they go in and they checked, and they got the space. They got 0.4 millimeters, 0.5 millimeters, so they're happy. Patient comes in for recare, that pops up on the x-ray, and it's like, oh, looks like you've got some calculus down there. Let's scrape that out. It's not calculus, it's just the tooth structure. So this unfortunately happens. And my mentor basically said, he's like, yeah, these are the types of patients that you basically give them free cleanings and exams for the rest of their life, so that way they stay at your practice and nobody else sees this. So you take care of them and you make sure that they're okay. But again, this is the danger that can come of end cutting discs because you don't have control. And so my favorite method is what I'd mentioned earlier. And we use it in this case where I actually did 0.5 millimeters canine to canine. And we even got 40 degrees of rotation on the canines, which is a significant amount of movement. But it came because we were able to create the space for the teeth to move into. And we did it in just 23 aligners. And this was the case, right? So they started off where this canine was pretty much like almost half covered by the incisors. And then we were able to improve it and rotate it out. Over here you can see we were able to get much better movement here. There's still some overlap, but way better than where we started. And you can see the angles of those there. And this was the high-speed burr method, right? So basically, with the high-speed burr method, I like to just take the red mosquito burr, and the width of this is 0.3 millimeters, okay? If you come all the way down here, it's gonna be more, so I always recommend you only put in about half the burr, and even if you can stay here on the tip, even better. But basically, you're just putting it between, or right under the contact point between the teeth, and then you are just kind of feather motioning up like a brush until you break that contact and you basically can see light come through. Now you know you're at 0.3 millimeters. So if all you had to do is 0.3, you're done. You just need to just do a little bit of, you know, kind of rounding out, smoothing out the surface with the polishing discs. Or if you need to go to 0.4, 0.5, you would just have the 0.4 and 0.5 quick strip and you just drop it in. And it's super easy because you already did 0.3 millimeters, right? So the hand cramps you were talking about, they go away like that. And it's, yeah, all of us are a lot more, I think, comfortable and better with a handpiece in our hands, right? Just from prepping and everything. So just taking a straight burr and kind of polishing and going up, I personally found this easier and I was more comfortable with it because I was just in more control. So this is a video demo of it. And so I like going from the lingual. Okay, so anytime you do this, you want to go in from the lingual surface. Don't do it from the buccal. And again, these are, looks like from Strauss. They make specific IPR burrs, right? And so this specific IPR burr, you can see they're not really feather brushing up. They're just sticking it between the contact and like one swiping up because these are already like predetermined sizes. I personally, I've tried that and I mean, it seemed like I chopped the tooth because it's like when you're just doing a straight line, teeth are not straight at their contacts, right? There's some curvature there. So that's why I kind of like the brush technique because you're not just chopping that off. You're actually able to kind of remove that friction. And you can, correct, you can contour it as well. So yeah, that's why I don't specifically like these like predetermined IPRs, but I mean, it seems like an orthodontist is doing it. So yeah. This is showing you just what the quick strips kind of look like. Cool, so yeah, quick strips, like I was saying, good for anterior. I don't recommend doing posterior IPR just in general. And this is a solid technique also because if you've got your mosquito burrs, all you need to do is get the quick strips. And for those, like I said, it helps you go to the 0.4 and 0.5 millimeters.
Speaking of resources, we have a bunch of free ones at our website, clearalineradvisor.co. It's everything that you need to get started with doing aligners. And so for those of you who are looking for the resources, mentorship, and support with aligners, I also have a course. It's called Aligner Blueprint. Details for it are in the description below. And I would love to support you if you want a very structured, simple way to get started with aligners.
So if you found one nugget in this training and you found it valuable, you need to go watch this video that I made. We go deeper in these aligner concepts. I'll see you in there.